there's some new research out of the San Diego VA hospital that shows that simple meditation actually used with military veterans with post-traumatic stress actually outperforms targeted therapies for trauma and other valued therapies that have traditionally been the go-to, the best practice to start with, such as prolonged exposure therapy and present-centered therapy. I'll explain both of those things. So, prolonged exposure is when you guide your veteran to re-experience the traumatic event over and over and over again, but in the safe space of a therapy office, so that over time, even though it's initially very distressing and triggering to re-experience it, under these controlled circumstances over time, the emotional charge connected to the event just dissipates. It takes a long time. It takes 8 to 12 weeks usually, typically, and it's sometimes so distressing to the end user that they don't complete the course. It's just intolerable. So they flee from the therapy, and they flee in worse shape than when they started because they're actively being triggered now. So that's a downside. If people complete the therapy, most of them do better. The problem is a lot of people don't complete. And VA practitioners sometimes are reluctant to use this, even though they've been encouraged to. Because of this, it feels so cruel sometimes to do that. Okay, present-centered therapy, which was in not so long ago research declared equally effective to prolonged exposure. That's when you just meet in a group, you talk about stressors in your life, current things, and current solutions that you use for the stressors. And just keeping it focused on non-trauma stuff, but just, sort of executive ego function, ability to deal and cope is very helpful. So, prolonged exposure, when used to completion, is very effective in reducing traumatic stress symptoms. And present-centered therapy is effective in just helping people maintain some kind of emotional evenness. Here's a study that basically shows that simple transcendental meditation, TM, I'm going to call it, is more effective than prolonged exposure, the go-to. And this was a study that was done at, as I said, San Diego VA hospital, and it was a randomized controlled trial, which we know is a gold standard. And this study was published in Lancet Psychiatry, which is not exactly chopped liver as a referee journal goes. So it compared this first study, TM, with prolonged exposure therapy, and then they compared those two things, those are the two active arms of the study, with standard health education. And this was 12 weeks, once a week. 203 veterans were with a current diagnosis of post-traumatic stress from their military service were each randomized to one of these groups, TM, prolonged exposure, which I'm now calling PE. The investigators started with a very unambitious question. Is TM inferior to prolonged exposure? Now that shows you where basically the VA stands on prolonged exposure. Gold standard, is TM inferior to that? And basically, not only did they find that it was not inferior, they found it actually performed better. So here's the thing. 68 vets were in the TM group, 68 in the PE group, and there were 67 in the HE group. And people were studied. They had to take the CAPS test, which is the clinician-administered PTSD scale. It's administered, obviously, by a therapist or a researcher, and it's coded, and it gives you hard results. It's been used in so many studies that it's highly reliable and valid. There were significant reductions in CAP scores, found most in the Transcendental Meditation group. And they were significant for prolonged exposure as well, but the TM outperformed. Clinical improvements were found in 61% of those receiving TM, 42% of those doing the PE, and 32% of the health education folks. Which shows you that any kind of attention to this is going to be somewhat helpful, but this grades the amount of help. The other thing I should tell you is, I forgot to mention, is that the PE people got individual treatment. The TM people worked in a group, and the health education people were in groups. Most therapists would say that that's an advantage given to PE, that they're getting individual one-on-one attention for those 12 hours. That's arguable, in my opinion. So the study concludes that, and listen to this because this is interesting to me too. The study concludes that a viable option for decreasing symptoms would be this transcendental meditation, a generalized meditation approach like TM. For people who do not respond to prolonged exposure or don't want to have it. Now, I would say, I think that's because of the great value placed on PE by the VA. But I would say this study suggests that you shouldn't start with PE in the first place. You should start with a generalized meditation, which is not going to be distressing and produces better results than the PE. You need to redo this study a few times to make sure this is valid, but I would say the study suggests that the go-to intervention first crack of choice is generalized meditation, not PE. It's just me, but I think it's also the study that points to that direction. So please leave any comments, questions, concerns, disagreements, outrage, happiness, anything below. Any comments, super welcome. Any questions. And part 2 is coming, which will talk about the other study, which compares meditation, a different kind of meditation, to present-centered therapy. So this will be a mantra or repetition of a phrase or emotionally healing word or two, just that repetition. Okay, so stay tuned. We'll be back.